question 1 is in recent year, which immune-related biomarker have been found for the systematic of the HCC?
So as you probably know, immune checkpoint inhibitors have shown significant advances in HCC and have now become standard of care of treatment. And unfortunately, not all patients benefit from this treatment. And there have been various approaches to identify biomarkers, mainly 3 different types: immunohistochemistry, PD-L1 staining, looking for tumor mutational burden, and an interferon gamma signature. And unfortunately, none of those have really proven to be a reliable biomarker. So we are still sitting pretty much in the dark.
Thank you. The question 2 is what are the main function of the immune-related biomarker in the systematic therapy of HCC?
Well, as I said, right now, I think we still have to collect them in order to get more data and more depth data, and identify some biomarkers in the future. But I don't think that we can use them routinely to predict response or choose a potential treatment.
Thank you. The question 3 is, as far as you know, which biomarkers can effectively predict the efficacy of systematic therapy of HCC?
Well, as mentioned, there have been attempts to do this using PD-L1 staining. But as it turns out, right now, we don't really have a very good biomarker.
Yes, the last question. What are the main challenges we face in the research and the application of the immune-related biomarker in the systematic therapy of the HCC, and how do you see the prospect of systematic therapy of the HCC in the future?
So in regards to the first question and the biomarkers, I think, we have to remember that a lot of times the HCC is actually diagnosed without a biopsy. So it makes it difficult that we don't have enough tissue archive to identify biomarkers from archived tissue. So we will basically have to put more efforts into collecting specimen. I think another very interesting approach is to study peripheral blood and circulating tumor DNA that may help us in the future to identify biomarkers. We have to perform, I would say, more thorough analysis and use more bioinformatics to identify maybe a combination of biomarkers. And in regard to the question of future treatments, I think it's pretty obvious right now that combination immunotherapy has become standard of care in the first-line setting, and I'm looking forward to novel combinations on one side, and I think another interesting approach is the potential use of adoptive T-cell therapy in HCC.